And hello again, folks. This is Dr. David, and tonight we'll be talking about hormone balance, the key to breast cancer prevention with Jackie Harvey. And just before I introduce her, I just want to mention this. We have many times at the beginnings of many of our presentations, we have talked about what we refer to as the central governing system. And these are the three systems which affect the other 9. We have a total of about 12 systems in the body. The nervous system, which is represented by the hypothalamus, the endocrine system, and of course the immune system, which is your defense, which helps to kill and rout out microbes, cancer cells, and all those things. What too few people do not realize is that the endocrine system plays a master role, the connection between the nervous system and the immune system, and of course all your trillions of cells, 60 to 100 trillion cells, they say. The endocrine system is so important to health and wellness. It coordinates everything, and for a while we were looking for someone who could help explain these, the importance of the endocrine system in layperson's terms, in a way that people could grasp and put into practice. And like I said, it was such an honor. It was such a relief when we had Jackie to come over and do that for us. And as you probably would have guessed, we have her come as many times as she can bear. And sometimes we even push her to do it more. So it's always you're in for a treat if you're coming in for the first time. I want to mention quickly too that you can go to our site, and obviously many of you have seen this. This is our homepage. What you want to do is that after the presentation, if there are questions that you have, you can actually click on Jackie's banner there. You can put in your questions and your comments, but also you can. We are making available for you, especially for those of you who joined this webinar, the Healthy Hormone series. Now, some of you bought it when she did her first presentation, but we're making it available again for those of you who registered for tonight's presentation. And this is a compilation of Jackie's presentations with a couple more. One by Dr. Jay Mead, with whom Jackie works very closely, and he knows a lot about hormones. And of course, Vitamin D and Your Health with Dr. Owens, again, someone that Jackie is very familiar with. This is a wonderful collection of education on the hormones. And usually it goes for about $60, but it is coming to you if you registered for this for $25, which is really a great deal. And without much further ado, I'm going to bring up Jackie's picture. And folks, Jackie needs no introduction. I'm going to say this: she is doing presentations around the world, well, around the country, both Canada and the United States especially, on hormones health. Her seminars are called Let's Talk About Hormones, and she has helped thousands of people regain their hormonal balance, and she's beginning to help a lot of people through our webinars as well. So we are really fortunate again to have her on. So Jackie, without much further ado, thank you for being willing to do this presentation, and I'm handing this over to you right now.
All right. Thank you very much, David. I hope everybody can hear me well. I'm always delighted to have the opportunity to share with Building Strength webinars. I really believe in what they do, and I appreciate what Dr. David is doing with everyone. All right. We're talking about hormonal balance, and we're talking about how hormone balance is a major key to breast cancer. This is the final week of Breast Cancer Awareness Month, and because of that, I've been invited back again, and I'm honored to be back again too. And I wonder how many people on this call have had women or even possibly men in their lives who have developed breast cancer. I think it's become so common that 10 years ago or 15 years ago, when I asked that same question of an audience, many did not have a contact with somebody who had breast cancer. That's changed dramatically. Here are some stats that I think are relevant. First of all, breast cancer is the most common cancer in North America for women. Secondly, it is the leading cause of death, cancer death, second only to lung cancer for women. And of all the cancers that women develop, 29% are breast cancer. I think another thought about this is that the reason we're so sort of tuned in to breast cancer and perhaps even fearful of it is partially because it's happening to women younger and younger. Now, the number of new breast cancer cases has definitely increased. In other words, breast cancer is on the rise. But each year there are new cases, and those cases are really truly developing younger and younger. Some of those new cases, about 11,000 of them, are men. And so we will talk about men and women's hormones with a focus on women's hormones, and I'll touch on some of the men's as well. But the estimated death rate from breast cancer is about 40,000 women per year. I think that's a horrific amount, and I know that for a while we were told that breast cancer rates were going down, but that has not proven to be true. I believe the best defense against breast cancer is a good offense, and so we need to take a moment here, and that's what we're doing this evening, to teach about what we can do. We're going to talk about 4 areas that are related to breast cancer and hormonal balance. Basically, the term prevention is not used ordinarily in the medical community when it comes to breast cancer. They talk about risk reduction. So we'll talk about risk reduction versus prevention tonight. There are risks that we can control, risks we can't control, and there are new risk factors that are out there that you may not be aware of, and we'll cover all of those. Then what I'm going to do is talk about, we'll do Hormones 101 as it relates to breast health. How do hormones affect breast tissue? Then we'll talk about testing. What are the best ways to test for hormonal imbalance? And then lastly, we'll talk about a program to restore hormonal balance that includes the acrostic DIP. All right, so risk reduction versus prevention. You know, the risks, there is a list of risk factors, and they fall into 2 categories: the things that you cannot control and those that you can. So let's talk about the ones that you cannot first of all. It goes without saying that just being a woman increases our risk. Now, there are a few men that are developing breast cancer as well for the same reasons as women, but women develop breast cancer 100 times more than men. And I think that's important to note. So that's something that you and I can't change, is our gender. Our age is a factor. You know, the stats show that from birth to 39, only 1 in 230 women will develop breast cancer, and that risk then is less than 0.5%. That's not a very significant risk, but you'll notice that from 40 to 59, that's what we call the perimenopausal age, the risk then increases dramatically from 1 in 231 to 1 in 25. Now that's a 4% increase risk. From age 60 to 79, the risk increases again to 1 in 15. And for women who think they have no hormones after menopause, look at this risk, that assuming we could live till age 90, our risk of breast cancer is 14.3% as a lifetime risk. But I note that the highest risk is from 60 to 79. So if we're talking about hormone imbalance, then those stats are real important. Certainly the past history of breast health for a woman is important. If she has had breast cancer in the past, then her risk increases for getting another cancer. Her family history, so if somebody in her family, her mother, father, sister, daughter, had breast cancer, that of course is going to be a risk factor that you can't control, but that increases our risks. You know, there are certain changes in our genes that are being noted, such as the BRCA1 and BRCA2. These changes also substantially increase our risk or show a risk. Radiation therapy, if anybody has done radiation, it's been suggested for Hodgkin's lymphoma, for instance. Even as insignificant as dental x-rays can add up and increase the risk of breast cancer for women. it would go without saying that our reproductive and menstrual history would be something to take a look at as well. The longer a woman is exposed to estrogen in her body, for example, the higher her risk. So we know that an older woman, the older a woman is when she has her first child, the greater her chance of breast cancer. She's had unopposed estrogen in her body longer, unopposed by the balancing hormone progesterone. We'll learn a little bit more about that later. A woman who's never had children, they're at higher risk because, again, they haven't had the opposing surge of progesterone in their body, but they've had a continuous amount of estrogen produced. The woman who had her first menstrual period before the age of 12 is at increased risk. Well, that makes sense as well, because the younger and younger a girl is, when she starts her menstrual cycle, that's her estrogen surge right there. So she has estrogen in her body longer than a woman who starts her menstrual cycle after the age of 13. Women who went through menopause after 55, again, they have a lengthened time of having estrogen in their body, so that would put them at higher risk. And studies have now shown that women who have been on HRT, hormone replacement therapy, for a number of years have a significant risk as well. In addition to these risks, our race can play a part. In the United States, for instance, breast cancer is diagnosed more often in white women than in African American women, although the African American women's stats are increasing. Certainly, anyone with a history of having taken DES, normally what happens is the mom takes DES, diethylstilbestrol, which was the first estrogen synthetically that was given to pregnant women in the United States between 1940 and 1971. Any woman who was born from a DES mom has a higher risk for breast cancer. And we still know that one cause of breast cancer, according to the Breast Cancer Institute.org and their fact sheet, is induced abortion. Now let's go to some risk factors that we can control. Certainly it's clear that there's a link between obesity, in other words, weighing more than that is appropriate for your age and height, and breast cancer. Again, overconsumption of alcohol. These are things that we can control. We know that a link exists between alcohol consumption and breast cancer to this degree that if a woman has more than 2 drinks, 2 alcoholic beverages per day, it puts her at high risk. Certainly a sedentary lifestyle will put a woman at risk. We need to stay physically active. Regular exercise does a number of things towards reducing our breast cancer risk. Helps us to maintain normal weight, helps us psychologically as well, and helps our immune system. Poor nutrition certainly is a consideration as well, specifically in the areas of eating improper foods, trans fats, for instance, and maybe a diet too high in animal fat, although that hasn't been specifically proven. But we do know things that have been proven is eat more vegetables, eat more fruit. They're high in antioxidants, and they're going to help foster diminished risk for breast cancer. Long-term use of birth control, long-term use has been equated to an increased risk in breast cancer. And I know that some may be surprised by that because birth control pills seem to be innocuous. But the risk data estimate that birth control pills use causes somewhere almost 5 out of 10,000 cases of premenopausal breast cancer, that is breast cancer in younger women. Most of us will be aware that exposure to pesticides and chemicals will increase our risk factor. You know, some of the molecular structure of some of these pesticides is identical to the estrogen that our body produces, and so it can actually go into receptor sites and act like an estrogen stimulating cell proliferation, etc. So we want to be careful and aware that pesticides and some chemicals can cause a problem. Excessive use of antibiotics could also be problematic and increase our risk of breast cancer. Some new things that you might not be aware of. Studies are showing now that low vitamin D3 could be a factor in breast cancer issues. Also noting low iodine stores or insufficient iodine could be another new risk factor, and low progesterone, which is the balancing hormone to estrogen. And we'll get into this in a little bit more detail. I think that what we need to note here for this evening is ensuring that every woman has adequate vitamin D3, adequate iodine, and adequate progesterone. I think that is what's imperative to the health of our breasts, and in making sure that our stores are adequate, that will reduce our risk for breast cancer. But again, more detail later. Balanced hormones are an important key to the prevention of breast cancer. And, you know, we believe that women have access to all the tools that they need to understand what's going on in their body and to move forward with a breast cancer prevention program. I really do believe that every woman wants to know what she can do to lower her risk of developing breast cancer. But I also believe that every woman wants to feel well. And to do that, we have to understand, you know, a few things: how our body makes hormones, what are the symptoms that our hormones out of balance produce, and then, you know, what can we really do to minimize those symptoms. So with that, I think that we need to talk about what hormones do in our body and the effect that they have on our breast tissue. Basically, all hormones are produced from cholesterol, and that might come as a surprise to some of you. We've heard so many negative things about cholesterol, but cholesterol really and truly is the main building block for all of the hormones that our body produces. So what we don't want to see is women prematurely going on statin drugs because they have elevated cholesterol in their body. Just because you have elevated cholesterol may not mean it's adhering to the artery walls. Dr. David Brownstein says, in fact, that when cholesterol elevates in men or women, you should test the hormone levels, because it might be a sign that the body's trying to produce hormones. And the first hormone in the pathway that is produced from cholesterol is pregnenolone. Pregnenolone is the grandmother hormone. It is probably more of a catalyst hormone. It doesn't appear to reflect an increase when we give women or men pregnenolone. However, from pregnenolone is manufactured progesterone. Now, progesterone gets its name because it is the progestation hormone. It's the hormone that maintains a pregnancy. But progesterone is also the hormone that balances with estrogen. And so it actually causes a balance to happen in such a way that it can protect our tissues from estrogen excess. So it would be really important that we maintain optimal progesterone levels. Well, from progesterone is produced cortisol. Progesterone is a precursor to cortisol. Cortisol, as some of you may know, is our stress hormone. It's a hormone that's produced when you and I are under lots of stress. And I'm trusting that everyone on the call tonight is not super stressed, because then that activates this mechanism, and we can suffer the consequences of adrenal fatigue if too much cortisol is being produced as a result of too stressful a lifestyle. But recognize, if our body is overproducing cortisol, it will have an impact on our hormones simply because progesterone is a precursor. Now, progesterone is also utilized in our body to produce testosterone, and our body does that by taking androstenedione and converting it to testosterone. And so in that, progesterone is a precursor to testosterone as well. And if you're getting the picture tonight, you're seeing that, you know, the key issue here is progesterone is a precursor to all the sex steroid hormones that our body is producing. From testosterone then is produced estradiol. From androstenedione is produced estrone. We have E1 and E2 estrogen. Those are very potent estrogen forms. E1 estrogen is primarily made under the influence of an enzyme called aromatase, and the amount of estrogen from E1 is determined largely by genetics and by the amount of fat cells in our body, because E1 estrogen is the primary estrogen that is produced in the fat that is located around our middle, between our armpits and the top of our thighs. So if you want to just do a body check right now, you can tell me whether or not your body is producing E1 estrogen through fat cell production. The second way that the body produces estrogen is from testosterone. That, of course, happens from ovarian production as well as adrenal production. And then both those two very potent estrogens are responsible for the majority of estrogen receptive positive breast cancer that's out there. E1, you'll notice there's an arrow between E1 and E2. E1 goes back and forth between E1 and E2. But it can become E2 estrogen, which is largely responsible for breast cancer. What is supposed to happen is estradiol and estrone are supposed to become estriol, which is the mildest form of estrogen located in our body, and be eliminated from the body. Doesn't necessarily happen that that's so. Estriol is called a very weak estrogen. Now, further to the pathway, here are the mechanisms. There are three ways that our body produces estrogen. In menstruating women, the ovaries produce estrogen. And that will continue until the ovaries begin to sputter and spark in the perimenopausal stage. At menopause, the ovaries slow down production very dramatically. Now, fortunately, the pickup mechanism that the body has, or the auxiliary mechanism that the body utilizes, are the adrenals. The adrenals are supposed to be there to pick up and produce a little bit of estrogen as a woman ages. The adrenals, however, if they're focused on producing cortisol, then the adrenal glands may not be available to produce a little bit of estrogen. However, there's a third way that our body produces estrogen, that is in our adipose, which is just a nice way of saying in our fat tissue. So again, androstenedione can convert in our fat cells and be converted to estrogen from the androgen hormone androstenedione or from testosterone. Interesting, this may or may not be the best news you've ever heard. Again, I suppose we have to look at what is our weight in order for this to take place. Dr. Lee used to say that all you needed was 10 pounds adipose tissue on your body in order to have this mechanism kick in, where your body actually stores and manufactures estrogen. And I guess most everyone on the call needs to ask themselves now this question, you know, will I ever need to invite a physician to prescribe for me additional estrogen? Am I ever going to need additional estrogen? If you have a bit of body fat, as little as 10 pounds excess body fat, you probably will never need to increase your estrogen level. Here is a life cycle that shows throughout from birth to menopause how our body produces estrogen. And if you'll look, you know, estrogen is produced in preteens, in children prior to puberty. And Dr. Geraldine Pryor is an endocrinologist at the University of British Columbia, and she says this about preteen production of estrogen. If a child is gaining weight, they have the capability in their fat cells as well of producing estrogen. And all children produce some. It's when it becomes excessive that we have a problem. We're noticing, for instance, that girls are beginning to menstruate younger and younger, and that could be a reflection on the amount of estrogen that their body is producing. You'll also note that in the teen years, estrogen levels fluctuate up and down and up and down. And I think that what we have to recognize here is fluctuating estrogen is not only common amongst teenagers, but is normal. It would be, to some extent, inappropriate at this point, at this juncture, to introduce birth control pills for that teenager to regulate their cycle. When a normal fluctuation and irregularity in their menstrual cycle is not only common, but it is normal. Then what will happen during the premenopausal years is estrogen will stabilize at a higher level, and then during perimenopause, approximately, anywhere from mid-30s to mid-40s, perimenopause begins. And you see even more dramatic fluctuations in estrogen than we had in our teen years. So if we thought our teens were hormonal, watch out for perimenopause. The other thing that Dr. Pryor says is that estrogen levels in perimenopause can reach ultimately 30% higher than they were in our premenopausal stage. And that means for hormonal women that this would be a very inappropriate time to introduce additional estrogen into our bodies. I think that recognizing that sometimes women believe that symptomatically in perimenopause, for instance, they develop hot flashes. Hot flashes, as evidenced by this perimenopausal fluctuation in estrogen, is not as a result of low estrogen. It's a result of estrogen that's driving up and down and up and down. So it is fluctuating estrogen that causes hot flashes. For the sake of hot flashes, many women have gone the route of adding more estrogen to their body and inappropriately raising estrogen levels at this age and stage, I think, is a risk factor for breast cancer. You'll note that in menopause, estrogen levels are supposed to decline, and that is normal. What we want to have as women is the appropriate estrogen level for our age and stage, an estrogen level where we can function at a very high level. The physicians that I work with and the people that I work with, we do not believe that we have to have estrogen levels of a 20-year-old in order to be healthy and to be well, and Dr. Pryor asserts that as well. Now, there are two ways that our body produces progesterone. Progesterone, again, is the balancing hormone in a woman's body. When bioidentical progesterone can actually turn off cell growth mechanism. If we look at estrogen as the hormone that causes cell proliferation, estrogen stimulates cells to grow, multiply, and divide, we would look at progesterone as the hormone that turns off cell proliferation. And in that, Dr. Randolph says it can have a cancer-preventing effect. It opposes estrogen, would be another way to voice that. Now, how does our body produce progesterone? The ovaries, our ovaries, while we are menstruating and ovulating, the ovaries produce progesterone. The little nest that the egg leaves from is called the corpus luteum. That produces progesterone. In other words, in order to produce progesterone in an adequate amount, a menstruating woman needs to ovulate. We've learned that that isn't always taking place, that there are some women that are menstruating but not ovulating. That would then decrease their progesterone stores. The adrenals as well are the supplementary or auxiliary system for production of progesterone. But again, if the adrenals are busy producing cortisol because you have such a hectic lifestyle and have so much stress in your life, then they won't be able to be available to produce a little bit of progesterone. And that would leave us in a progesterone deficient state because primarily the adipose tissue does not make progesterone, and there's only very small amounts produced in the brain. Progesterone slows abnormal and normal cell growth, and according to Dr. Taylor, says a study that was done at Johns Hopkins Medical School showed that women with a progesterone deficiency were 5.5 times more likely to have breast cancer prior to menopause. So we know that women that are not ovulating are going to be at high risk for breast cancer because of insufficient progesterone. Now, insufficient progesterone, elevated estrogen, Dr. Lee called this the problem of estrogen dominance. Dr. Pryor calls it estrogen excess. Either way, the problem of estrogen dominance begins often with the interference of a menstrual cycle, and then it continues on into menopause. I want to show you how that evolution can transpire. If you look at the yellow line, that's the line of the body producing progesterone. In the teen years, from 10 to 20s, progesterone levels begin to soar as the ovulatory cycle normalizes. Initially, it's erratic, and then it soars and stabilizes. Progesterone stabilizes at 100%. From age 20, progesterone levels begin to decline. Now, depending on a woman's ovulatory pattern, if she is not ovulating every single cycle, her progesterone stores will drop even more dramatically. But we see a very dramatic drop in progesterone from age 50 to 60 for sure, and a slow decline between age 20 and 40, which are the childbearing years. The pink line represents E2 estrogen, or estradiol, that's produced in a regular menstrual cycle, and then it goes back and forth as it's produced in fat cells. And you'll observe that estrogen levels do not fall as dramatically as do progesterone levels. In fact, at age 50, when the ovaries are pretty much finished their work of producing estrogen in the menstrual cycle, and that's where normal menopause starts for most women, approximately age 52, we start to see estrogen levels rise. Well, think of the mechanism of how our body produces estrogen. Our body's producing estrogen as menopausal women primarily in our fat cells. And if you've observed women with me, as I have, they're not losing weight as they age. They are gaining weight. And I've come to the conclusion that relatively few women will need estrogen as we age. Probably we could use a little progesterone to match up with our estrogen, since our progesterone falls into the basement. Let's look at the menstrual cycle, and I want you to observe a few things here. The spike in estradiol, which is E2 estrogen, is the red line in the center. Estradiol spikes in the menstrual cycle and then falls. Look at the pink line for progesterone. Progesterone is low through the first 18 or 19 days of the menstrual cycle, and then spikes and then falls. In order for a woman to have a normal menstrual cycle, she has to have the rise and the fall of estrogen. She has to have the rise and fall of progesterone. And you'll notice that with that rise and fall of estrogen and the rise and fall of progesterone along the bottom, the lining in the uterus is produced and sloughed off. If, in fact, there is only a rise in estrogen and the woman does not ovulate and produce progesterone mid-cycle, the lining in the uterus will continue to grow and could develop hyperplasia. In the same token, without enough progesterone being produced, could put us at risk for breast tissue stimulation, overstimulation by estrogen. All of this is called estrogen dominance. Dr. Lee and Dr. Pryor, many physicians today are talking about and using the term estrogen dominance. Some of the symptoms are located here. For instance, all PMS, according to Dr. Pryor, is connected to estrogen dominance. Dr. Fleckus says estrogen dominance usually occurs at menopause when progesterone production falls to approximately 1% of its premenopausal level. So we see estrogen dominance amongst women that are still menstruating via PMS, and we see it amongst women who are no longer menstruating and exhibiting some of the other symptoms that are related here. I'm not going to cover all the symptoms except for the bottom one that we talk about here as breast cancer. Now, breast cancer could be classified as a symptom, but it could also be classified as an effect. What causes estrogen dominance? Well, we have diet issues. You know, we're not eating correctly as a nation. We're over-consuming carbs at the expense of proteins and essential fats, and so we're gaining weight. Our diet is causing weight gain. We're taking in inappropriate amounts of estrogen through our food. Some people think that eating foods that are high in estrogen are better than not. Soy would be an example. We don't agree. Soy foods may not be the most beneficial form of food for some people. Other nutritional deficiency, impaired liver function, so on. Stress certainly is going to be one of the causes. Environmental issues. I mentioned the fact that pesticides and chemicals can come into our body, become xenoestrogens. Overexposure to these xenoestrogens puts us at risk. And I've starred the doctor-caused iatrogenic risk factor by being given or offered the opportunity to use birth control pills or going on conventional hormone replacement therapy. I want to talk about that issue for just a moment. Dr. Helen Leonetti is a board-certified OBGYN in Pennsylvania. She is an authority on the use of bioidentical hormones, including transdermal progesterone. And this is her comment. If you decide to turn to conventional medicine for balancing hormones, they either ignore your hormones or they attack them with synthetic substitutes that make you feel worse, not better. And that still seems to be the prevailing attitude out there. The medical options revolve around hormone replacement therapy that is straight estrogen, unopposed by adequate progesterone. HRT, that is estrogen, it could be bioidentical or not, but again, they often prescribe it with Provera, which is MPA, medroxyprogesterone acetate, which is a synthetic form of progesterone. And then lastly, the resolve and the reserve is birth control pills. All three of these are not necessarily good options for balancing hormones. And if you look at the historical perspectives and ask ourselves the question, where do we go from here? I think it's very appropriate. You know, bioidentical hormones in 1939 were made available. Dr. Russell Marker determined that from yam or soy could be produced bioidentical estrogen, progesterone, and testosterone. Again, there was a media blitz in the early 1960s, and Dr. Robert Wilson wrote his famous book, Feminine Forever, that he said that women would just become, you know, old shriveled up prunes if they didn't take estrogen. And so that began the whole focus on estrogen only. By the mid-1970s, too many women developed endometrial cancer. And so the grow, multiply, divide issue of estrogen was taking its course in the uterine lining and causing all these women who had a uterus on unopposed estrogen to develop uterine cancer. They had to go back to the drawing board, and they discovered that they needed to balance estrogen with progesterone. The progesterone that they used was a synthetic one, simply because, again, progesterone that is bioidentical can't hold a patent. And so progesterones were developed and combined with estrogen. Prempro would have been the example. Premarin made from pregnant mare's urine, bioidentical to a horse, but not necessarily to a woman. Combined it with Provera, medroxyprogesterone acetate, and was given to women for over 40 years. Now that combination was studied for the first time in 1993, and the Women's Health Initiative showed that, in fact, the risks outweighed the benefits. The study was 16,608 healthy women. The study that involved healthy women meant that women who had heart disease were not invited into the study. Anybody with breast cancer was not invited into the study. Anybody with, you know, a risk for stroke or a risk for breast cancer was not invited into the study. That study was stopped 2 years early because the risks showed to outweigh the benefits. And look at the risks. A 49% increase in stroke for women who had no risk. The gals with the risk were not invited into the study. I think more importantly, if you look at the last risk, so there was a tremendous increase in risk in the first three risk factors for heart disease. Now, it's amazing to me that women were offered the opportunity to go on HRT and estrogen alone to protect our bodies from heart disease. And I've just talked to Dr. David. I think I'd like to do a webinar on hormones and heart disease, because I believe that there's a real correlation here. Nevertheless, the straw that broke the camel's back, the thing that stopped the study 2 years early, was what showed up was an increase in breast cancer. Again, the breast cancer risk of 29% more than caused women to shudder. And of course, many women went off their hormone replacement therapy at that time, and the doctors advised them to do so. Well, what was the problem then with HRT? Well, too much estrogen that didn't belong in our bodies. It belonged in horses' bodies, and it was too potent for us. Provera, on the other hand, the Prem-Pro part of Prem and Provera, has numerous side effects listed, and it's not progesterone. It's a synthetic analog of progesterone. So it doesn't do all the same things in the body, like protect our tissues from estrogen excess, which bioidentical or made in the body progesterone does. The progestins in Provera, again at the top of the list, increase our risk of breast cancer. But they did a whole number of things as well. And then there's every evidence that it is the progestins, the Provera part of the Provera hormone therapy that cause the greatest problems. There's also a problem with the birth control pill. The birth control pill contains similar hormones and identical hormones to HRT, and a lot of women don't know that. Only they are in greater amounts. Now, all birth control pills stop in using the same mechanism, or start working by stopping ovulation. When you stop ovulation, you stop the body's production of progesterone. There is no possible way that putting a teenager or a young woman on the birth control pill, number one, will cause balance to her hormones. Number two, it only acts as a Band-Aid, so when you stop the pill, all the problems which she had for which she was being medicated with the birth control pill will come back. And I believe that for many women, imbalance and their risk of breast cancer can begin with the use of the birth control pill. As it relates to breast cancer and young women, I want to read to you from an article that Dr. Lee wrote in his book, What Your Doctor May Not Tell You About Breast Cancer, by Dr. John R. Lee. He says this: when teenage girls take birth control pills, it increases their risk of breast cancer. It has been well established that when girls between the age of 13 and 18, and to a lesser but still significant effect, women up to the age of 21, use birth control pills, their risk of breast cancer can increase by as much as 600%. The younger a girl begins to use contraceptive hormones, the greater her risk of breast cancer. And because girls are reaching maturity much earlier today than even 10 or 20 years ago and are more freely using contraceptive hormones, we have to ask whether this scenario is going to lead to a significant increase in breast cancer, particularly premenopausal breast cancer, which tends to be more aggressive, unquote. Well, guess what? The risk for premenopausal breast cancer is on the rise. Certainly between the age of 40 and 50, that the breast cancer rate has really dramatically increased, and between 20 and 30, it's definitely on the rise. We have to wonder then whether the birth control pill, even in its low-dose form, is a contributing factor. One study that combined the results of a variety of studies showed that there was an association between birth control pills and the increase in breast cancer risk. The study also showed that this slight, and I should have put that in quotations, increase in risk decreased over time. But how much time did it take for the risk to decrease? Look at this. After 10 years, birth control pills were not associated with an increase in risk. In other words, a woman using birth control pills doesn't have a reduced risk until after 10 years. The risk on the pill was 5 in 10,000 women. I personally don't believe that a contraceptive, any type of contraceptive method should cause cancer. That's a personal conviction. I hope some of you on the call share that with me tonight. So what's the solution to hormonal imbalance, or what Dr. Lee called estrogen dominance? Well, first of all, education. And you're on this call tonight. I commend you and encourage you to share this information this evening. And one of the ways to do that is to avail yourself of the promo that Dr. David is putting out there. The Healthy Hormone Package is 5 very excellent webinars that will lead you in your journey towards hormone health. And he'll add the one for this evening as well. Read John Lee's books. Make sure that you become informed by the people who really understood the issues. And John R. Lee is quoted by just about every physician who writes a book today. He was considered the guru of hormones in his day. Dr. Lee passed away in 2002, and we lost a great advocate for women and women's health. we have produced a DVD that's actually been produced to honor Dr. Lee. It's called Let's Talk About Hormones. It is available on our Help for Hormones website and covers different information than even what I'm presenting this evening. So I encourage you to educate yourself. There's lots of good tools that are out there for education. And by the way, the DVD covers different topics and different format than even the Healthy Hormone package. So all of these tools are available to anyone who wants to become more educated. What I believe about education is that it is the key to your power. The more educated you are, the better able to make a good quality choice and decision for your own hormone health. The second solution to dealing with hormones is to do a saliva test. Now, saliva testing has been done by the World Health Organization for the last decade. We believe saliva testing to be one of the most accurate methods available today to evaluate the actual amount of hormone that is available to receptor sites. When a person does a blood test, hormones in the bloodstream are bound to protein, and there's only less than 2% that are available to actual receptor sites. So when you do a blood test, it evaluates all those hormones, including the bound and unbound. When you do a saliva test, it only evaluates the bound hormone, or the unbound hormone, so that gives you a more accurate evaluation. Dr. J. Mead at Labrix Clinical Laboratories, who we deal with, says with saliva it's possible to get a good measure of the amount of hormone actually available to the tissues, and that's the term bioavailable. This is because hormones have to pass through tissue to get into saliva. Hormones in blood are often bound to proteins and may or may not be available to tissues. Consequently, blood and serum levels of hormones may not give or reflect the best picture of how hormones are behaving at the tissue level. And we would agree. We encounter many women who say to us, you know, I did a blood test, came back, my doctor said I'm fine, I really am not fine. So we are advocates of saliva testing. I personally have overseen 8,000 saliva tests in the last 10 years, and I know for a fact that for women, their symptoms are identified through a saliva test. So why test? Well, again, if your symptoms, if you are there tonight and thinking, well, I wonder if my symptoms are related to a hormone imbalance, test. It's an easy thing to do. If you've been diagnosed with osteoporosis, osteoporosis, Dr. Pryor says, is a deficiency of progesterone, estrogen, and testosterone. And so making sure that you have an adequate amount of estrogen, progesterone, testosterone would also be then a prevention program for osteoporosis. Do you feel that you need a balancing program? If you do, the place to start is with a test. We test, we don't guess. None of us are seers. We want to be able to understand, is there really an imbalance in your hormones? And many women are on bioidentical hormones. They're on bioidentical estrogen or bioidentical progesterone. I have them calling me all the time, and I encourage them to evaluate their current hormone therapy. You see, a saliva test evaluates the exercise program you're on, the nutrition program you're on, and all the good things that you're doing for your body, including hormone therapy if that's what you're on. So it takes a snapshot in time and will tell you whether all those things together are producing a balance. Now, men can test their hormones as well. It would help them to determine their risk for prostate disease, but also help to determine their risk for breast cancer. And the same is true for women. What hormones do I test? Well, we have 3 test kits available off our website. A 2-panel test tests estrogen and progesterone, and it's just a one-time test. You spit in the tube 4 times throughout the day, morning, before breakfast, before lunch, before dinner, and before bed, and send it off to the lab. Test 2 hormones. A 3-panel test tests 3 hormones, would test the above 2, estrogen, progesterone, as well as testosterone. And then a 5-panel test would be appropriate if you are under a lot of stress. Remember, stress has an impact, profound impact on our hormones in that you're overproducing cortisol. And so the 5-panel test discerns whether or not cortisol levels are inappropriately high, or if you've burned out your adrenals and they're inappropriately low. DHEA is another hormone that goes with stress as well, and so often we'll see low DHEA, low AM cortisol for people who have been under stress for a long time. And of course, that's going to have an impact on your progesterone level. Again, it's easy to test. You basically spit in a tube, mail the samples off to the lab, and your results are emailed to you within 7 days of the receipt of the sample by the lab. And what I offer to anyone who's on the call this evening is if you order a test kit from our website, then by all means we'll offer you a free review to go over your test results to make sure that you understand exactly what it's saying, so you can work with your healthcare provider, or if you choose, you can work with us as well. All right, another evaluation tool is mammography, and I want to talk about that versus what I would think is a better choice, which is thermography. And I had a woman ask me that question today, so I thought I would include it in our overview today. Mammograms, regular mammograms, are being encouraged by the medical community, and as early as starting in the mid-40s. Dr. Lee said that if you started a mammogram at 55 and did one annually until you were 65, it could increase your risk for developing radiation-induced breast cancer. Again, because a mammogram provides an X-ray, and that's ionizing radiation. Ionizing radiation is a risk for can increase our risk for breast cancer. Now, certainly it's a method of detection. Whether or not it produces the right results begs the difference. And I would just remind women that when you go to the dental office, they usually, before they do an X-ray of your mouth, they cover your breasts. And that's a much less ionizing radiation than would be given for mammograms. Mammograms have an appropriate use, and that is when a lump is detected. If you have not detected a lump, perhaps another alternative would be to do medical thermography. Now, thermography is heat detection of the change in tissue of the breast. The more heat, the redder it becomes on the thermogram. And again, thermography can pick up tissue changes 5 to 8 years before a mammogram can detect a lump, which is a structural change. So I think that for everyone, it's safer even after puberty to do thermography, and you're not going to be exposing yourself to inappropriate amounts of radiation. If you want more information about that, you can ask me, send me an email, and I would be glad to do that. Clinical breast exams are still the best way to evaluate. Make sure that you have a medical exam with your physician on a regular basis, and then continue to do breast self-exams. Actually, the Susan Komen Breast Cancer Foundation offers a really nice flash presentation that I think you would find appropriate if you don't know how to do a proper breast self-exam. Once you've evaluated what your hormones are doing and you've educated yourself appropriately, I think the next step then goes without saying is to embark on a program, to do a course correction, if you would, and do something positive. Dr. Lee talked about balancing hormones this way. He said that estrogen levels needed to be modulated. The main way to do that is with nutrition. Progesterone, there was nothing that you and I could eat that would either increase progesterone levels or subdue them. So he was a strong proponent of using a bioidentical progesterone cream. So let's talk about the solution of what happens when estrogen is excessive. And I had the occasion while I was out touring in the last week of talking to a pharmacist. And I always ask pharmacists, because they produce bioidentical hormones, what do you do for a woman who has elevated estrogen? Or what do you do for a woman who has estrogen levels that are fluctuating? And most of the time, they do not have an answer. So that's a good question to ask of your healthcare practitioner. When doing a saliva test, if your saliva test comes back that your estrogen is fluctuating or it's elevated, you need to know what to do next. Well, modulating and stabilizing estrogen starts with good nutrition. We believe that the platform for the production of hormones by your body and mind is going to be eating correctly. And what we teach is eating 40% carbs, 30% protein, and 30% essential fats. Now, there's a book out there called The Formula. The authors are on the screen. That's an outstanding book. Basically, it teaches you how to take the foods that you enjoy. Nobody has to eat what they don't like, but the foods that you do enjoy, and just put them in a balanced perspective. And what this will do, number one, it helps your body to produce hormones appropriately. And number two, it stops your body from insulin resistance. Insulin resistance overstimulates testosterone and throws testosterone stores way too high. With having said that, I note that women today have too much testosterone, often not enough. So, in modulating and stabilizing estrogen, step number one is going to be to eat right, and then focus your 40% carbs in this way. Number one, make sure you're eating the carbs that are high in fiber. You want to increase your fiber intake to between 30 and 50 grams a day. Why would we do that? Because hormonally challenged men and women need to increase their fiber intake. We don't need 30 grams, we need upwards to 50. And the reason for that is because we know that dietary fiber lowers circulating estrogen levels. There's studies that show that if we intake a correct amount of fiber into our diet on an annual, on a weekly basis and a daily basis and a meal-by-meal basis, that our body will reduce the amount of circulating estrogens. It only takes out the estrogen that's not in receptor sites. And that's very important to have happen. So increasing fiber intake, very important. If you need to use a fiber supplement, we think that's A-OK. I have a fiber supplement at the end of this presentation. I recommend a fiber supplement called Fiber Max with 2 X's. And the reason I recommend it is because it works. It actually helps to modulate and stabilize estrogen levels. Number two would be to increase the amount of water and increase your exercise. There are more than just one eliminative pathway. Certainly fiber will dramatically affect bowel function. We note that lots of hormonally challenged men and women have poor bowel function. So fiber improves bowel function, and in doing that, it increases the eliminative pathway through the bowel. Now, increasing water consumption will also help the kidneys flush out excess hormones, and exercise causes the skin to flush out excess hormones. Now, again, those are 3 really good eliminative pathways. In order to get the exercise to kick into gear, you have to exercise until you perspire. Consuming an adequate amount of vitamin C in an ascorbate form, and again, this is for adrenal support so that your adrenals aren't taxing your hormone levels. You want to make sure that your adrenals are working optimally, and one of the main supports for the adrenals, according to Dr. James Wilson, who wrote the book Adrenal Fatigue, is vitamin C. So vitamin C the need for vitamin C is dramatically increased when we're under stress. So we don't suggest a lot of things to support the adrenals, but vitamin C would be one. Dr. Brownstein, David Brownstein, talks about the hormonally challenged woman requiring about 3 grams of vitamin C, as opposed to the 500 milligrams that probably the majority of people are consuming. So that's 3,000 milligrams of vitamin C he recommends on a daily basis. So we know that our intake of vitamin C probably is not very great. We recommend further an ascorbate form of vitamin C rather than ascorbic acid, because ascorbic acid is very hard on your digestive tract. That would be like eating 60 oranges a day, and you wouldn't do that for very long. So an ascorbate form is simply buffered, and if you want a recommendation, we have one of those at the end of the presentation as well. For our purposes, vitamin C is found to be breast protective. Again, it's an antioxidant. It doesn't surprise me that we need more than the minimum amount of vitamin C on a daily basis. Vitamin E would be another antioxidant vitamin. Both of those, it doesn't surprise me that antioxidant vitamins would serve us well in the protection in our prevention program for protecting us from breast cancer. Next, to increase the amount of indoles that are in your diet. Now, indoles are found in cruciferous vegetables. That's broccoli and cauliflower, cabbage, and kale. Increasing your consumption of these foods lightly steamed is a very good idea. So in the carbohydrate section, we're looking at these forms of vegetables as being superior. You don't want to eat too many of them raw because their goitrogens are hard on the thyroid, but eating them lightly steamed, appropriate. And the studies showed that you needed somewhere about a pound of cruciferous vegetables a day. This is one source that you might want to take as a supplement, simply because eating a pound of broccoli every day might be onerous for most of you. Indole 3-carbinol does a lot of things hormonally in the body. It actually helps to eliminate excess estrogen, and it eliminates xenoestrogens via the liver. So it actually is a liver detoxifier, very important. It increases the good estrogen and inhibits the bad estrogen. That's very, very important as well. And it does some very good things. But for anyone who's concerned about elevated estrogen, indole 3-carbinol, both in food form and in supplemental form, are imperative. Consuming additional fruit and vegetables as a concentrate to supplement the gaps in your diet. If you're not taking in a large quantity, the 8 to 10 servings a day that the food guide suggests to be optimum of fruits and vegetables, then you would want to make sure that you supplement. And I know for myself, I don't eat perfect every day. And so taking a fruit and vegetable concentrate on a daily basis to increase my antioxidants to protect my tissues, again, is a good breast cancer prevention determination. Again, researchers found that women who ate large quantities of fruits and had a 35% lower risk of developing breast cancer. The risk was 46% lower when these same women ate higher amounts of vegetables. Again, the key is get more antioxidants into your diet through proper fruit and vegetables. They are the best choice of carbohydrates. Vegetables first, then fruit. Fruit's high in sugar, so you want to not eat as many fruit as you do vegetables, and whole grains would be the last. Use a moderate amount of calcium, preferably a plant-based source. A small amount of calcium helps the blood reach homeostasis, and I think that's important as well. We're not into lots of calcium for the reason that calcification throughout the body seems to be escalating, and make sure then that if you're sourcing a source of calcium as a supplement, that you don't take more than 350 milligrams a day, and take it from a plant source. One of the ones we recommend is made from seaweed. So again, dealing with estrogen, stabilizing your estrogen level in your body, and making sure your adrenals are working well involves these three things, or these simple things. Increase your fiber. Add additional vitamin C. Add additional indoles. And make sure that you're getting antioxidants appropriately from fruit and vegetables and from calcium. And where wisdom dictates here, if you can't get enough of these in your diet, then by all means supplement. Add to that these three things, and they create the acrostic dip. Vitamin D3. It's obvious to us today that vitamin D3 is deficient in a literally epidemic situation. It's estimated that between 75 to 90% of the population has insufficient vitamin D3 levels. Well, according to Dr. Christine Northrup, the shift that there is now towards increasing vitamin D3 it's a paradigm shift that's going on with and because of new medical research. So where they wanted to have a small range as normal, something below 30 as the normal range, and I'll show you a chart in a moment that gives the range. Now that we want to see anywhere from 60 to 80 nanograms per mol as our goal. Vitamin D3 and hormones, well, basically vitamin D3 is the natural human form of vitamin D3 that's made in the skin when cholesterol reacts with sunlight. So our skin is the main manufacturer of vitamin D3, and because of that, and now the vitamin D3 works in the cells at a different location, they now consider vitamin D3 a hormone. Don't confuse vitamin D3 with D2, which is a synthetic analog and is found in most multivitamins. We need actual vitamin D3, preferably made on your skin by the sun. Secondarily, make sure that if you're going to supplement that it is actual vitamin D3. There's lots of research to show that vitamin D and breast cancer have a reception. If you test your vitamin D deficient breast cancer patients for vitamin D receptors, they won't have many, but if you give them vitamin D3, they develop receptors. Very interesting. So women with breast cancer showed to be having insufficient receptor sites for vitamin D3. All you have to do is give them D3 to have those receptor sites develop again. Latitude counts. The saying is that anywhere north of the 35th parallel, that's San Diego, and we probably are deficient. And so understanding that the areas that have the most sun were half as likely to die of breast cancer. So the connection between D3 and breast cancer is developing huge. Now, I don't want to spend a lot of time on all these, just to know that if you can go to the website, Dr. Cannell's website on vitamin D3, the D3 Council, it's called, and you can find all kinds of these studies that are showing that the average person does not get enough vitamin D3 on a daily basis, and it's putting women and men at risk for breast cancer. We believe in D3 testing. It's a simple blood test. What we've discovered, though, is that most of the time the physicians are not willing to do it in Canada, for instance, because the Canadian system is attempting to cover the costs of all testing, so they're no longer testing D3. That means that every individual in Canada is going to be on their own hook for vitamin D3 testing cost-wise. In the United States, the cost for D3 testing is sometimes prohibitive. We offer a test that isn't prohibitive. We encourage all women and men who are at risk for breast cancer to test their D3 levels. Testing and not guessing, I think, is real important. Dr. Northrup also encourages women to test their D3 levels, and we concur with her that that's a great idea. Now, by the way, right after the summer is a great time to test your vitamin D3 level to see should you be supplementing or not. Did you get enough vitamin D through your sun exposure over the summer? So it's a great time right now to test to see how much should I be supplementing now into the winter. Iodine levels. Iodine stores are connected to, depleted iodine stores, it appears, are connected to breast cancer issues. We note that insufficient iodine has an effect on thyroid hormone production as well. But we also note that it has an effect on breast tissue in the form of fibrocystic breast disease. Dr. David Brownstein is the front runner with Dr. Abrahams and Dr. Fleckes, and they've determined that low iodine stores result in an increased risk for fibrocystic breast disease and an increased risk for breast cancer. If you understand the mechanism that iodine uses, it desensitizes estrogen receptors in the breast, and in doing that, it can also reduce estrogen production in overactive ovaries. So desensitizing breast tissue and reducing ovarian production of estrogen are both very, very important. And so we believe that low or insufficient stores of iodine is another contributing factor to the breast cancer. And again, there's a test for iodine insufficiency that we offer. It's a simple 24-hour urine test. Dr. Mead is very supportive of using this test to determine, are your iodine stores low? Now, both vitamin D3 and iodine are very inexpensive to supplement if the tests show that you are insufficient. I mean, less than $10 a month is the amount for vitamin D3 and the amount for iodine. My goodness. So it is critical, however, if you are at risk, to test your D3 levels, test your iodine levels, see if you are insufficient, see if you have need of these two nutrients in your body. The last one, of course, is progesterone. Bioidentical progesterone is available through a number of delivery systems. There are pills and there are creams. We believe in using a cream form because the delivery system is everything with this. If you use a pill form, you're going to get less than 90% of that pill actively going into receptor sites. With a progesterone cream topically applied to the skin, it gets into the receptor sites very quickly. The parameters of a progesterone cream, I know that they're sold over the counter in the US. They're available through us in Canada. Just make sure that you're using an optimum progesterone cream. I've had the privilege of working with Dr. Lee, and we formulated a specific cream for hormonally challenged men and women. We've put a progesterone, a good amount of progesterone, 1,000 milligrams per 2-ounce tube, into a cream that is an aloe vera base. And we did that specifically because we note that hormonally challenged men and women often develop rashes and have allergies to various products. So aloe vera seems to be a really good base component, and the majority do not do that. How much will you use? 20 to 40 milligrams in a divided dose. Men would use half that much if their progesterone stores show to be low on a saliva test. We have at least 3 sets of handouts that we use when we work with women to help bring balance to their bodies. And three of those handouts are on how to use progesterone, how to get the most from your progesterone, and what to expect while using progesterone. So for women who are aspiring to work with us, we provide them with an adequate amount of information. In fact, I would say this about that. Don't buy a progesterone product anywhere unless they give you adequate information on how to use it and how to test to see whether it's appropriate for you or not. Men, their progesterone levels decline after 60, and this is when we're starting to see an increase in breast cancer. Again, remember, progesterone opposes estrogen in a man's body as well. It inhibits the aromatase and 5-alpha reductase conversion of testosterone to estrogen, and so it does that for women as well. Progesterone in women, it protects our uteruses from endometrial cancer, but it does help to protect our breast tissue because it opposes estrogen in our bodies. And, you know, it does other things. It does lots of other things. It helps with bone density issues. It helps with endometriosis, again, opposing estrogen for uterine lining. I've saved the best for the last. I think that this study shows the effect of progesterone and estradiol, both bioidentical, on breast tissue. If you look at the placebo, they compared the application of progesterone and estrogen to breast tissue with a placebo. If you note the estrogen level on a placebo, the effect of the tissue is at the 8 mark. When they added estrogen, it caused stimulation and caused more cells to be produced. And so that cell proliferation skyrocketed under the influence of E2 estrogen. Now this is bioidentical. When women say to me, oh, bioidentical estrogen is safe, I tell them estrogen is estrogen is estrogen. If you elevate estrogen levels inappropriately for your age and stage, it puts your breast tissue at risk. Period. End of statement. When they combined estrogen with a bioidentical progesterone, it certainly slowed up cell proliferation dramatically to that below a placebo. So no question that adding a bioidentical progesterone is a safety factor. It opposes estrogen. But recognizing that adding progesterone to the mix, just progesterone by itself, stopped and slowed up cell proliferation dramatically. And that's what we want to see by the majority of women out there who are estrogen dominant, or even if they have normal estrogen levels. Adding progesterone is protecting our breast tissue. Now, this is a picture of a thermogram. This is what thermography tests are. And I'd like you to look at the area on the left picture that is in the pink area where I show the cursor. They used progesterone topically applied 30 milligrams a day for 3 months. And look what happened to this area on the breast. It diminished dramatically. The green area enlarged, the pink diminished. The same thing is true for the opposite breast, and the pink area, you'll notice it diminished just in 3 months of using transdermal progesterone. And I venture to say if they would combine that program with reduction of or modulation of estrogen using some indoles and some fiber, you'd even see greater results. In the next slide, this is also thermography, and this shows a lesion in the right breast of the woman in the left slide. What we did with her is they gave her over a 24-hour period 20 milligrams directly applied to the lesion. And at the end of 24 hours, you can see where this lesion is quite large. And remember, thermography reveals lots of vascular activity in an area, and this vascular activity is what indicates a problem. Well, the lesion here had significantly diminished vascular activity after just 24 hours of topically applied progesterone. We know that balancing progesterone with the amount of estrogen in a woman's body is significant in a breast cancer prevention program. Using progesterone in aging women, no question about it that aging women benefit with utilization of bioidentical progesterone, preferably with the delivery system as a cream as well. It helps with brain function. It helps protect the aging woman's breast tissue. Remember, if she lives to 90, her breast risk is over 14%. So we want to ongoingly, in aging women and aging men, protect their breast tissue with a little progesterone. Dr. Lee says this about all hormone programs. Number one, only use hormones if you know that you truly are deficient. How do you know that? You do a saliva test. Test, don't guess. And then when your test results come back, only use bioidentical hormones rather than synthetic hormones. You want to use the kind that are manufactured in such a way that they are identical to the hormones that your body makes. And then lastly, you want to use doses that are appropriate for your age and stage so that you actually achieve balance. Suzanne Somers talks about all of us having hormones of a 20-year-old. Well, our hormones aren't supposed to be that of a 20-year-old, and Suzanne Somers has had breast cancer, and she's also had her uterus removed because of hyperplasia. Both are estrogen excess, progesterone deficient problems. We've produced a balance pack for women who want to balance their hormones, and we've added to that balance. We add to that balance pack a vitamin D3 spray. We've created a spray sublingual vitamin D because, again, hormones are best applied topically or sublingually for sure, not as a pill. So if you're taking D3 as a pill, it may not be as effective as you would want. If there's anyone paying attention tonight who's interested in a program, by all means you can contact me. I would be glad to help anyone on the call. And again, if you decide to purchase a saliva test to evaluate your hormones, or an iodine test or a vitamin D3 test, we'll offer a free review. So basically, this isn't a difficult thing, this prevention program. It does involve becoming educated. It does involve evaluation tools that are now readily available to you and I so that we can monitor our own hormones ourselves. We'll provide a free review for that. Then you take that information and begin a program. And everyone on this call can begin a program today. And I invite you to start with good nutrition, get a hold of that book, The Formula, and begin. So what will you do? Well, supplementation, if you're not able to eat as much as you'd like. Fiber, vitamin C, indoles, calcium, fruit and vegetable concentrate, supplementing with vitamin D, supplementing with iodine. Again, all of this is readily available from a Max Alive consultant. Just all you have to do is email me. We'll help you with that. Exercise, I don't want to underestimate the value of exercise, and I don't want to underestimate the value of supplementation specifically with D3, iodine, and progesterone for breast health. Very, very important. I believe when we accept responsibility for the health decisions that we're making and that we have made in the past, and then we begin to take responsibility for our own current hormone health, only then can we begin to move forward towards true health and wellness, and particularly towards true breast health and wellness. Maximize your life, balance your hormones. Learn more. If you want our DVD and CD, by all means visit our website. We invite you to do that. We are always warmly welcoming consultants. Our goal is to have consultants in every state in the United States and every province in Canada, so that we would be able to invite you to reach out to women and share this very, very important information. A reminder that Dr. Lee said that if women would go on the program I've just outlined tonight, that we would prevent 80% of breast cancer from ever happening. So this is a very important situation for me. Included in this is a reading list. So for those of you who purchase the promo package, you'll get our reading list, and in each one is a reference list, very extensive if you want to do your research. Again, test kits are available from our Help for Hormones websites. Supplements are available. You would need to go through a consultant, but you can go and take a look and request a consultant by just contacting me at helpforhormones@gmail.com. All right, Dr. David.
Yes, ma'am.
We rock and roll through this, don't we?
You sure do. This is great info. Great info. Thank you so much again. I'm going to take it back briefly while the questions are coming in. And folks, just if you're new here, just remember you can type in the questions in the blue panel to the right of your screen, and be sure I have everything together here before I switch screens completely. Boy, what wonderful information. What wonderful information. We actually had one of our doctors who she's a regular presenter with us, and she's like, I need to have the MP3 of this thing so I can listen to this on the go as well. So, and I did mention, folks, at the beginning of this presentation that let me see if we can get this right. Okay, and I know Jackie mentioned it as well. There is a healthy hormone series which we promoted last time, but we're making available again, primarily for those of you who registered for today's webinar at a much reduced price of $60. Excuse me, the price is $60, but it's $25 for a short while. Now, this program contains all of Jackie's previous webinars, the one on hormonal balance, the one on men's hormonal balance, women's hormonal balance, and of course she mentioned Dr. Jay Mead, who is an authority in this field and with whom Jackie works a lot with. The saliva testing all go through Jay Mead, and he provides her with the tools and the resources and some information too, which I'm sure she presented some of that tonight. And of course, Dr. Owings, she did a wonderful presentation. Actually, it was her and Dr. Pendergast who did a presentation on vitamin D, which again, Jackie mentioned tonight. So lots of great information. We will, if you buy the package, we can convert some of them to MP3s for you, so you can listen to them on the go. Just let us know. All right, so what we're going to do is, Jackie, I'm probably going to send it back to you so you can show. I'm sure some of them would like to see some of your other slides again. So I'm going to send this back to you right now.
All right.
All right, let me get the questions out. Hang on just a minute.
Maybe I could just start by saying I think that it's real important for women to pay attention to the information and go over it and over it. You know, we are the hormonally challenged, and sometimes we don't remember with just one one exposure. And so that's why I think it's real important to educate. I'm very encouraged with the physician who is wanting to listen to it over and over. If a physician is saying that, how much more we should.
Absolutely, absolutely, and this is she actually is she understands this thing, and she teaches about this as well. So apparently, there's some good information that will help to strengthen her knowledge base as well. So good stuff. All right, let me ask her questions first because she has some questions.
Good.
Please discuss why progesterone is advised transdermal rather than oral or sublingual.
All right. Sublingual might be okay because, again, think of the concept, the delivery system is important. If we deliver hormones, we want to, say we deliver 10 milligrams of hormones, we want to make sure that the delivery system is getting the hormones to the cell in an efficacious way. We know that if we use a delivery system where we use a pill that has to go through the digestive tract, that 90% of that pill is going to be shunted out of the body through the digestive tract and as metabolites, and only 10% is actually left as hormones. So we have to dose really high. An example of that is using prometrium. And the side effects of the metabolites that are excessively produced, if you were to give, say a woman needed 40 milligrams of progesterone, which Dr. Lee suggests in his information, you would have to give 400 milligrams of prometrium to get 40 milligrams. Well, all those metabolites that are produced, 360 milligrams of metabolites make people dozy, they make them feel unwell, and so really the delivery system is very important. The other thing about the oral route of delivery, it's not normal. The body doesn't normally create hormones and drop them into the digestive tract. The body shunts them into the bloodstream right away. So when you use a cream to apply progesterone topically to the skin, then you're getting it directly into the bloodstream, which is very good. Now, and again, we've been able to do lots of research using saliva testing and applications and so on, and we know it gets to receptor sites very well. The problem with sublingual could be spiking. I had the occasion to work with a company that was trying to produce a progesterone product, and we looked at liposome as well, and both liposomes and sublingual we felt spiked the hormone level and didn't give a nice even feed. We know that putting it into the bloodstream through the skin seems to give a nice even feed. Now that's a long answer for a short question.
But it's complete. That's good. That's good information. All right, here's another question from another doctor. Boy, we have a few of them on this call. All right, this is a challenging question. He says, please respond. It's a guy this time. Please respond to the following statements. Bioidentical hormones, I think he got this from Wikipedia. So, bioidentical hormones may present extra risks due to the process of compounding. In addition, the accuracy and efficacy of saliva testing has not been definitely proven, and the long-term effects of using blood testing to reach target levels of hormones has not been researched. Now, how long have you been doing this, Jackie?
15 years.
15 years. That sounds like long-term to me. Okay, you want to respond to this?
And tell me, I've never heard either of these questions before. Okay, bioidentical hormones are no different than any other hormones in that I believe if you OD hormone levels with estrogen, for instance, that you will have a risk. But I don't think that the factor is the compounding pharmacist. I was reading in Dr. David Brownstein's book on supplemental thyroid. And he made a case for supplemental thyroid coming from two different sources. One was from an animal source, and the other one is Synthroid. levothyroxine, just straight T4. The other one is part T3 and T4 from an animal source. Do you know that in my own research, I proved that the thyroxine that was made in the laboratory by the pharmaceutical company was inferior, had been challenged more times than the one that was made by the company that had made it from a desiccated thyroid or from an animal source. So I don't think that the issue should be taken up with compounding pharmacists. Certainly, you know, I think the issue could be made up with any manufacturing company. You have to know that who you're going to manufacture your hormones, supplemental hormones, is going to, you know, be good. Now, from what I've learned, the PCCA, that's the Pharmacy Association, that are teaching and have standardized compounding, are doing a very good job. And so I would say to this physician, you know what, go and talk to one of the pharmacists. Do not take the party line that all compounded hormones are going to be negative. I'm going to tell you right now that in the manufacturing process, there's no way that anybody who's making supplemental hormones is going to be able to produce them 100% all times, including whatever company a person would use for, you know, other than Premarin and Provera, for instance. And if the alternative is Premarin and Provera, then I'm not up for that. Now, esterase, I mean, there's a variety of forms that are very good as well, but they are bioidentical. If the issue is with the compounder, I'm sorry, I can't buy in. I think that compounding is going to be an appropriate way for a physician to be able to access specific amounts that are not provided for a physician by some of the other companies. The fact that it can be put into a cream is not available by other companies. Now, they use patches for estrogen, but the only way that a cream can be manufactured and stabilized is through a compounding pharmacy. So if for anyone who wants to use cream, you know, supplements, there's not going to be an alternative. Now, as far as the accuracy of saliva testing, Dr. Mead would be better able to take that on. But, you know, saliva testing has been done for a long time. Just because the physicians are not tuned into it, or and what I have found sometimes is what we don't understand, we poo-poo. I think that having a conversation with Dr. Mead, taking a look at his information. There's lots of research out there. There are at least 5 or 6 labs that are doing saliva testing with good accuracy. And if you consider that the blood test includes the bound and unbound hormones, then, you know, if that could be specified in a blood test. I know, for instance, I was speaking to a gentleman in Canada who is in charge of all the testing, the laboratory work. He knew that saliva testing was more accurate, but said that they would never get it into Canada because it would mean retraining the doctors. I know, sad but true. So I don't think accuracy is the issue. I really don't. I think it's what are you most comfortable using. And remember, Dr. Mead says very strongly that bioidentical hormones don't show up in the bloodstream. Hence, Suzanne Summers, who uses blood draws to evaluate, she's on really high doses of hormones. Dr. Helen Leonetti has done research using both. She's an OBGYN in Pennsylvania. She uses saliva testing. She now knows it's more accurate to evaluate once a person is on bioidentical hormones. So maybe it's a case of what's appropriate for what you're doing.
Okay. Great. All right, here's another question. Are conjugated hormones safe, as in taking senestin or for estrogen replacement? Does that make sense?
No,
let me try and see if I can ask that again. Are conjugated hormones safe, as in taking senestin for estrogen replacement? Does that make sense to you?
No, I don't know senestin. I'm not familiar with that term.
Okay.
Well, people have to remember, I'm not a physician. So conjugated
right.
estrogens. So conjugated estrogens are just manufactured hormones. So
Okay.
it depends on the source again. All right. So if we're sourcing conjugated estrogens from horses, no, I would say not. That they have too many hormones in that conjugated estrogen. That conjugated meaning manufactured. All right. In that manufactured hormone that are not available to us. If you're taking a plant source of estrogen, or originally from a plant source, and we go back to Dr. Russell Marker's 1938 revelation that he could make all hormones bioidentical to a human from a plant source. And I think that we can look at those are manufactured hormones that are appropriate and would not, if used properly, create an imbalance. But again, estrogen is estrogen is estrogen, David, you know. And so
Right.
I'm not on the side that say you can take any bioidentical hormone and it will never cause you cancer. My perspective is even if your body is overproducing it, it can cause cancer.
That's a good point. That's a very good point. All right. Ernst says, I am a master herbalist and I would like to be a Max Alive consultant.
Well, I
So,
would warmly welcome them. Absolutely. I am a teacher at heart, and I train all the time. So how about an email to my helpforhormones@gmail.com, and let's begin to visit.
great. And he also asks, is it possible to get these charts in some other forms? This is very good.
What does that mean? I just lost you, David. What does he mean?
Maybe the charts, I guess the charts, the graphs that you showed.
Oh,
Maybe
sure.
that's what it is.
All my consultants have access to all of my presentations, every one of them. Just like Dr. Mead gives me access to his information, I send it as PowerPoints. So that, I mean, I want everyone out there, every man and every woman, to understand the issues, and I cannot do it myself. Nothing's exclusive here. And besides the fact that there's no new thing under the sun, Jackie Harvey hasn't created something here, folks. This is all information that's readily available.
You've just been able to pull them together and make them more understandable to the layperson than pretty much anybody out there, huh?
Absolutely. We want the light bulb to come on and a wealth of understanding. I'm not anti anybody. I work with wonderful physicians of all varieties. I mean, some of the people that I just love the most are physicians and as well as endocrinologists and so on. So I work with people who are definitely in the medical field. We consider what I'm sharing tonight medical model, but it is complementary medical model.
Absolutely. Okay. Okay. I need to watch some of these questions here. A couple of people said that was an excellent presentation. I need to get the whole series. Thanks so much, David and Jackie. Thank you. Some questions you just can't ask because they're too
specific. They're specific.
They're too specific. And
tell them to email me. If anybody has specific questions, they need to email me. We're not going to deal with any health challenge individually here on this call tonight.
Thank you, and that helps us keep on, and that keeps us safe, folks. I mean, obviously, we have to be compliant in several respects, and you wouldn't want us to go off the air for any reason. So, help you by
anyone who's listening, David. They should start with a saliva test. Don't list all your symptoms to me. If we need to know, we test. We don't guess. So I'm not going to say, well, you've got this symptom, this symptom, this symptom, and this is what's wrong with you. I can't do that. Legally, I can't do that. But the lab can connect whether or not your symptoms have a hormone connection, and they'll make the connection for us. And it's, I think that's where everybody on this call needs to realize, if you want to know what's going on with your hormones, you must do a test. Otherwise, you're just guessing.
Yes, don't guess. I like that. All right. Do men need to take a break from progesterone during the month?
I advise that they do, because they're often sleeping with a woman who's also on progesterone. And if they continue to expose themselves to progesterone, they jeopardize her. And all women should take a break. So I feel personally, both my husband and I are using a progesterone product. We evaluate on a regular basis, and we take the same week off so that we're not counter-exposing each other. So I would say yes.
Okay. Okay, great. How about women who have had a hysterectomy?
A woman who's had a hysterectomy is in the same place as a woman in menopause. Even, I guess it will depend on whether or not she had her ovaries removed or not. But Dr. Lee always said that even at that, because the main blood supply to the ovary was disconnected from the uterus at the time of surgery, even if the ovaries were left in, they don't last long. Sometimes they traumatize on their own and stop and shut down. So we look at even with the ovaries left in, probably they don't function at a very high level for any longer than 5 years. So if you've had a hysterectomy longer than 5 years, then you're just a menopausal woman. Women in menopause increase in girth, sad but true. So we increase around the middle, and that's our estrogen-producing fat cells. And so most women in menopause, when we evaluate our hormones, we have either normal or elevated estrogen, and we have very low progesterone. And depending on our stress, how low our progesterone gets. But if our stress accelerates, then our hormone's even worse off, and it starts to affect our adrenal glands as well. But we're all kind of the same, and I haven't noticed that menopausal women have less stress than women of other age groups. In fact, I think what tends to happen with menopausal women is, we worry about not just our own home and our car and our kids. We now worry about our grandkids and their homes and their cars.
more to think about, huh?
Yeah, and it's, stress just, it comes and resides with us. It's how our body deals with stress. I think that is important. I really am an advocate, David, of finding that place of peace so that our hormones can be appropriately produced.
I know. Okay, speaking about adrenal glands and stress, I almost missed this question by the other doctor. Okay, what about a woman who has virtually no estrogen and is highly symptomatic even on progesterone? Would support of the adrenal glands handle that entirely without having to give more estrogen?
I don't know if, because women that are under lots of stress tend to be that type of woman. Either stress is going to affect them or it doesn't. And if it's ongoing stress, I doubt that adrenals can be restored to the degree that they're optimally producing hormones. But with having said that, I would look at the woman's body. Is she overweight? The only women that I see that need estrogen supplementally are very slender women. And if she's not a very slender woman, then I would say to get on our estrogen modulating program, and you'll start to see a rise in her estrogen level on her own.
Okay.
Yeah, some women are producing E1 estrogen in their body fat, and it's not revealing itself. It's not converting to E2. So, indoles and the things that we've outlined help to cause the body to properly deal with estrogen. And I think that that's more important even than adrenal function for women. I just think stress is such a huge issue. We need to do all we can to support our adrenals, but to rely on our adrenals for that little bit of hormones that we need through menopause might, for this culture, not work.
Right. Speaking about adrenal fatigue and stress, Jackie, I may need your help because Erin, Dr. Mead's wife, was meant to do a presentation for us on, what was it called again? Both adrenal fatigue and fat gain. And I think something went wrong, and we never really got back to it again. I think her marketing person has taken over, and anyway, she's in the way. So we need you to get on Dr. Mead's case so he can get on his wife's case.
She actually sent me her presentation. I have her presentation. So
all 120 slides.
yeah, she sent it to me for me to look at it and approve it.
Oh, really?
She's a wonderful naturopath. She's just a lovely lady. But you know, those
Yeah.
folks are real busy. Not that I'm not, but you know, they're real busy. And sometimes speaking isn't the easiest thing for a physician to do. So, well, let's talk about it, David. Maybe I'll do that one for you too. That's another possibility. I could
Well,
do that.
it just keeps getting better and better.
I'm not so sure. For who?
For us. We don't care about you, Jackie.
You know, I'm the other thing. I mean, I do understand. I get this. You know, I'll stand up to any of the physicians, and I'll get this. You know, when I was in Portland, Oregon, the obstetrical doctor who was in charge of the department at the Portland Adventist Hospital invited me to come in and share this. And he said he was retiring, so he didn't mind bringing in somebody who wasn't medical, had a medical degree. But he promised that he would make sure that the doctors didn't talk to me in their medical lingo, and you know, because I'm not there for sure. But I had one woman come down the aisle, and I thought, oh, I'm cooked. Oh, what did I do wrong? And she stopped in front of me and she says, Jackie, I just want you to know, where have you been all my life? She was a physician who was fragmenting because of her hormones. So as long as you protect me, David, that's all.
We'll try our best. But you see, this is so liberating for people. Well, when I first, like I mentioned, when I first saw how important the endocrine system is, and mind you, all we knew about the endocrine glands and the hormones were basically what the full-blown disease, the problems with the hormones. But no one ever talked to us, or we never really learned the importance of balancing hormones before the disease condition happens.
Well, and in fact, the term balance still is not used as a medical model term. Because balance is relative, right? The amount of progesterone in a woman's body it needs to be relative or related to the amount of estrogen. And the lab denote, and Dr. Lee said this as well, for every one estrogen in a woman's body, she should have 200 to 600 progesterone. And that's over the years what has stood as the evaluation tool. So we know that, I mean, we've been raised as women to think that our estrogen levels are sky high and that progesterone is just a little bit. It comes as a real shock that progesterone levels should be 200 times that of our estrogen.
Wow. Never heard that before.
And that's why lab reports, I think, are in this case are very important. And just for the sake of the physicians who have been listening, you know, I've done about 8,000 saliva tests, and the two labs that I've worked with have both been founded by medical doctors and so on. And really and truly, we're seeing a consistent pattern amongst the women that come to us. Now, granted, I don't see the rank and file women. I'm seeing women who are specifically, they hear my name in conjunction with hormone help, and they have an intuitive need for what we're providing. So perhaps our numbers are kind of skewed to the side of all the women that I'm seeing, for the most part, are hormonally challenged. But for the doctors that are listening, I mean, my goodness, there's, you know, what is their solution for elevated estrogen? If estrogen, I know what everybody decides when hormones are low, to give bioidentical hormones. But what happens when estrogen's high? And I have yet to encounter a woman with elevated progesterone. That's an interesting thing.
You have not, huh?
I have not. And it's an amazing thing. Even with supplemental progesterone, for some, you know, I mean, we're just not seeing elevated or out of range progesterone levels with women who are on supplemental progesterone. So I think that between compounding and over-the-counter products, we're doing a pretty good job of bringing that progesterone back into balance. And remember, for everyone on the call, there's nothing that women can eat that elevates progesterone, which is interesting to me. Lots of estrogenic foods out there, but there's nothing that will produce progesterone. And I haven't heard of anything producing testosterone either.
And those are extremely important.
Well,
as they grow
necessary
older.
for bone health and for brain health, and on it goes.
Right, right. All right, here's a good, interesting question. Have you seen bioidentical progesterone cream cause rapid heartbeat, breathlessness, and or insomnia? Would this mean the progesterone is too high or too low or something else entirely?
Something else entirely. It sounds to me like whoever's using the progesterone is experiencing what I call an estrogen dominant crisis, and that is that it accelerates estrogen. Estrogen is metabolized more efficiently in the presence of progesterone, and so if you have a large amount of estrogen circulating in the bloodstream, then I think that you'll start to get symptoms that are exactly what have been described here. So they are estrogen dominant symptoms related to the stimulation of estrogen receptors not needing so much estrogen. So that we incorporated our program, David, for that reason. We saw that happening too, so the symptom of rapid heartbeat, for instance, Oprah Winfrey was one who had that symptom, and Christine Northrup told her she was progesterone deficient. She went to 5 cardiologists before she realized that Christine Northrup was correct. Dr. Northrup recommended she get on some progesterone. But you have to take into consideration that there needs to be a balance between estrogen and progesterone. It's not just about taking progesterone, and I hope everyone on this call heard that tonight. Because you can take progesterone and it stimulates those darn estrogen receptors, and you end up feeling worse, not better.
Test, don't guess.
Test, don't guess.
I love it. That's what we should take away from this. Okay, well, we're wrapping this up. Again, some questions about how to get the series. Some people didn't hear that, so I'm going to mention this again. There's a Healthy Hormone series, which includes tonight's webinar along with 5 others, and we're talking about at the minimum an hour and a half. So these are things you're probably going to have to listen